Fundamentally, the Social Determinants of Health course attempts to understand factors affecting health and health outcomes that fall outside the health sector itself. A lot of times when we study health, when we study public health, we're primarily concerned with health services. So whether it's hospitals, doctors, pharmaceuticals and drugs and so on. But in fact, studies have shown often that more than half of the health outcomes and the differences in health outcomes we see within countries and between countries can be due to and caused by factors outside the health service itself. And broadly speaking, we refer to these as the social determinants of health. So students taking this course will be learning how to critically engage with health questions in order to try and understand more complex and broader causal factors shaping health outcomes. Students will not be given a simple menu or simple way of solving health problems, but they will be shown how to ask questions in different ways and to look for solutions in other places. Ultimately, the social determinants of health means understanding how multiple social, structural, upstream, political, and economic factors shape people's health and health outcomes, and students learn how to understand those questions, ask questions about it, and search for evidence to try and understand better what determines health and health inequalities. Students really find interesting the ability in this course to engage in topics that they personally have an interest in. So they have choices in the course of topics that they can present in seminars. So we have seminars on things like early childhood development, gender in health, the built environment in which people live in health, and they get to select a topic in which they present. But then students also get to select specific countries and health issues to present in group work and in their essays as well. So students really find it interesting in the fact that they can tailor their experience to apply the concepts to particular issues and to particular health problems that they are interested in. Well, the Social Determinants of Health course fundamentally tries to get students to understand how health and health outcomes are driven by and fundamentally determined by real-world social structural conditions. And so understanding better how political factors, economic factors, whether it's social arrangements like gender, like education, like trade agreements, how these things fundamentally shape health outcomes will have real-world implications for students wanting to change health outcomes and improve health policy ultimately.